Hi, this is Ken Core, Congregational Care Minister at Brentwood Baptist Church. The current pandemic has created an uncertainty of the future, lost opportunities, financial hardship, fear of contracting the disease, and isolation from our friends and coworkers. All of this leaves most of us with emotions that are hard to manage: grief, loneliness, depression, anxiety, anger, impatience are just a few. In addition, being quarantined at home can heighten the tensions that already existed in the family between husbands and wives, or parents and children, or siblings. In many cases, talk therapy may be the best next step in getting back to a healthy life. Most people have never experienced talk therapy and are not sure what to expect. When people come to therapy for the first time, they often ask about what to say or do. They begin the initial intake session with words like, "I've never done this before," or "I'm not sure what I'm supposed to say." The reality is there is no right or wrong way to do therapy. No one has ever done your therapy before. So just go with it and trust your therapist. The therapeutic process is relatively simple. I use the formula, insight leads to change, change leads to healing. The therapist's job is to lead the client to think through the issues, to raise questions, to put the life pieces together until there is some insight into what is needed. The counseling environment provides a safe place for people to process all of this information in a way that the old anxiety defenses can begin to come down and insight can begin to form. Once the client has insight, then the question is what to do with it. This is where therapy will use different interventions to encourage and promote appropriate change. One of my mentors used to say, most people don't want to get well, they just want to feel better. Getting well means making too many changes. At some level, we all resist change, but successful therapy will lead to change. And those who work through the resistance and make the difficult changes needed are the ones who move to healing. Let me give you an example of what this might look like. This story is not a real client, but a composite of many clients that I've worked with over the years. An individual comes into therapy because of problems with a supervisor at work. Unless this can be resolved, they fear that they cannot stay in the job. After a few sessions, the insight emerges that the supervisor reminds the client of a parent who was abusive. This childhood trauma is being relived in an unconscious way and projected onto the supervisor. This insight leads the client to think about what to change in order to withdraw the projection of the bad parent onto the supervisor. Over time, the client begins to think differently about the supervisor, to act differently around the supervisor, and to regain their emotional regulation. The insight of childhood abuse led to the changes in thinking and behavior, resulting in emotional healing. Insight leads to change. Change leads to healing. This is just an imaginary example, but it might give you some idea of what you can expect in therapy. Most clients discover that therapy is not as scary as they imagined, and they find the help that they need. If you think that you would benefit from talk therapy, I can assist in helping you find a therapist that you can trust and with whom you can work. Contact me at kcore@brentwoodbaptist.com. and I will work together with you to find a therapist that is appropriate. This is Ken Core with a mental health moment.